Hello, my name is Shaniqua Smith, and I am working towards becoming a physical therapist. Physical therapy is therapy intended to help those individuals who are suffering from a medical injury or condition that limits their mobility. Physical therapists typically utilize equipment or various forms of exercises in their treatment plans. Some equipment that'll be used in a physical therapy session might be treadmill, which would be used for walking and in some instances running, medicine balls used to perform various exercise activities, dumbbell weights for weightlifting, bicycles or stretching bands, and oftentimes therapists will revert to things like swimming or massages to help treat a patient. And according to WebMD.com, manual therapy such as massages can help relax muscles and increase circulation in injured muscles. The patients typically treated by physical therapists might suffer from things like muscle disorders, developmental delays, which will be seen in kids, head trauma injuries, sports injuries, or just wear and tear, which would normally be seen in the relatively older patients. The job duties of a physical therapist might consist of reviewing the written referrals of a new patient to get a preview of what to expect, review the patient's medical history, then they'll examine the patient to see what level they're on. So they'll look at things like muscle strength or range of motion just to see where they might need to begin. Then they'll develop and execute a treatment plan for however long that may take. It is the therapist's job to communicate with the referring physician and family members. And once the patient is discharged, the therapist must educate the patient on ways to prevent future injuries and to give them exercises to continue to do at home. Most physical therapists typically work full time and during normal business hours. You do have a few that work part time or few that will work evenings or weekends, but for the most part, they are working normal business hours and are full time. Physical therapists complete their work mostly in hospitals or private therapy practice. However, there are other places where you might find a physical therapist, like in schools or fitness centers. And as a physical therapist, you do not necessarily work alone. You are a part of a team. So it's not just you and your patient, but you also have to deal with the patient, the referring physician, the physician that referred the patient, or you might have to deal with if the patient see like a speech pathologist or an occupational therapist, you might have to deal with them. And then other physical therapists that work in the same setting as you, you'll probably help them or they'll help you with your patient. If there are physical therapist assistants or aides present, then the physical therapist must supervise them as well. To become a physical therapist, you must go through 4 years of undergraduate and then graduate from a accredited physical therapy program, which most programs are now 3 years, so they're a doctor of physical therapy degree. If you choose to specialize in a special field, then you'll complete a 1 year residency just to, know what you're getting into. To practice in physical therapy, you must first complete the National Physical Therapy exam. And some states require, some states don't, maybe a state law or any other exams or applications needed to obtain a license in that state. And majority of the states, they either have 2 or 3 license terms, and they require different requirements to renew your license. That may be a certain amount of CEU or a certain amount of CCU hours, which CEU stands for Continuous Education Units and CCU stands for Continuous Competency Units. So that may vary. I know, for example, the state of California offers a license term for 2 years, and you must complete 30 hours of CCU courses and a mandatory CPR and ethics course. On my route to be a physical therapist. First, I plan to continue my classes here at USF until next May when I'll graduate. But in that time, I'll gather more volunteer hours and shadow hours at the VA hospital and Florida Tampa General just to continue to, be polished and get some more experience. Then in August, I'll register to take the GRE, and in October, I'll take the GRE, and then start applying for schools in October and November to get those in before the deadline. And hopefully next August, I'll be starting physical therapy school and complete my 3 years of there. And then once I come out, I want to practice in California. That's where I want to live. So I have to take the California law exam. That'll be around September. And then in October, take the NPTE exam. And also in California, you are required to get fingerprinted, federal record check, and jurisdiction record. So I'll also get that upon, passing my 2 exams. After I do that, I should be able to get my license for physical therapy. Then I'll join different organizations. So I know I want to join the California Physical Therapy Association, and then the APTA, the American Physical Therapy Association. So I'll join those organizations to get my foot in the door, meet new people, and be able to find different job opportunities out. And then in December, January, finish my job searching, and hopefully by January 2023, I'll be able to begin my career as a physical therapist. Here are my references throughout my entire presentation. Thank you.